This marks the third time the Prime Minister has spoken about organ donation in Mann Ki Baat, putting the much-needed spotlight on a challenge the country faces, that of shortage of organs. But before the bad news about the shortage, the good news first. Organ transplants have seen a four-fold increase in the country, from less than 5,000 in 2013 to nearly 20,000 in 2025, according to the Government of India. But here's the catch. Nearly 18% of transplants are currently being performed with organs donated from dead donors, and dependence on cadaver donors is way too high.
We all know that kidney disease have become an epidemic, and it's very difficult to diagnose kidney disease at a very early stage. So what we see mostly in the outpatient clinic is the patients who are coming in a very late stage, and when they require either dialysis or kidney transplant.
This figure is upsetting to say the least. As of late 2025, over 82,000 plus patients are actively waiting organs, with the majority needing kidneys and livers.
Right for heart, if I say, almost 50,000 patients are waiting at a time for a cardiac transplant, and actually how many get it? Just 200 to 300. So there is a huge gap between organ donation and the requirement for organ donation. Similarly with the kidneys, there is a dearth of somewhere around 90,000 patients who are waiting for kidney transplant. Some 50,000 waiting for liver transplant. But actually what is happening, we are just able to cover up ranging from 0.2 to just hardly 2% of the patient population.
Organ transplants have come a long way. The first successful human organ transplant was a kidney transplant performed in the month of December 1954. Liver, heart and pancreas transplants were successfully performed by the late 1960s, while lung and intestinal organ transplant procedures began in the 1980s. Among the advances that modern medicine has brought, organ transplantation affirms the very spirit of humanity. For a country like India, creating a robust, ethical and scalable organ transplant ecosystem was not just a necessity, but a moral imperative. India has built one of the most comprehensive and integrated organ transplant frameworks in the global south.
So for kidney transplants, we have grown in technological way, like most of our donors are having laparoscopic surgery, and now in recipient also, a few of them who are obese, they have advantage of robotic transplant surgery. But unfortunately, in terms of increase in the number, that has to be really worked on, because we haven't seen significant increase in number of transplant.
So can organs, say a kidney or the liver, be retrieved from a deceased who suffered diabetes, hypertension? Yes, says the Indian Society for Organ Transplantation.
And India doesn't have the very good disease donor program as compared to what most of the European countries have. The organs like retina, heart or kidneys, if they are, or the lungs, if they are not damaged because of these diabetes, then we can actually harness liver and kidney. And this same thing is being applied for the living donation also right now.
Experts also say over the past 5 to 6 years, misinformation has spread, fueled by vested interests. False claims that doctors are certifying brain death and harvesting organs for commercial gain have done a lot of damage.
Most of our donors are live related. So your donor has to be a relative and alive. So we have 2 kidneys. So he has to live the rest of his life with 1 kidney. So as I said, there is another fear in most of our population that if we lose 1 kidney, our survival would not be the same. The second way we can increase the donor pool is promoting donation of organs after death. I think that part is really needs to be worked on.
While concerns remain, there is superstition and fear that also play a big role in preventing people from donating organs of their loved ones.
Few beings, they do have this kind of belief that we donate some organ, we may not get the organ in next birth. So these kind of myths are being, we are trying our best to get rid of these kind of myths.
So how does organ donation work? How does one convince a patient's family that he or she is brain dead? Like in the case of baby Alan from Kerala, a 10-month-old who recently donated 5 of her organs.
There are multiple people which are involved, every hospital and all that. We try to first convince, someone has to break the ice that the patient is brain dead. So there is a whole criteria for that which we follow. There are apnea tests which are done. We try to convince the family, because the consent has to be given by the family member, that they are ready to donate the organs. And I would say it is right from the schooling onwards. We should convince. Right now, various schools, we organize certain things where we tell that organ donation is good. So right now, patients come and they said that I want to donate my organ if I have any such thing.
How does one really go about donating the organs? What's the procedure here?
There are organ donation cards which are available online. We have Indian Society of NATO National Organ Tissue Transplant Program. So you can log on to their website and really fill up the form to donate your organs once you're dead. But despite that, our law is a little stringent to allow donation even if you have filled the form, because your relatives need to agree to that.
Well, did you know that you can donate all your organs, even your skin, if you want? A single donor can help multiple people through the donation of their heart, lungs, kidneys, liver, pancreas and much more. It's not even counting the tissue donation, which can help dozens more. We are busting the myths around organ donation and telling you what the facts really are to encourage you to donate your organ if at all you get an opportunity. Have you ever thought of becoming an organ donor but held back? You have had your doubts. Well, our experts are busting all myths and telling you all that you need to know about organ donation. So donating an organ during one's lifetime is extremely risky. Isn't that a myth?
All the donation that happens is a very scientific process. Even the deceased donor is a scientific process where you evaluate the donor, and then if the organs are good and functioning, you use them. For a living related donor, it is a very, very hardened, structured and very enormous evaluation that happens over 4 or 5 stages in the donor. And once they become okay, then only they can donate. So donating organ is a very scientific process. They would donate organ if only they are medically completely fit.
Only young and perfectly healthy people can donate. What are doctors then saying?
There is a criteria for each organ, and the age varies from 18 to 55 years for liver and 18 to 60 or maybe 65 years for kidney. So it is desirable to have young donors because their liver functions and other things would be better. But it's not that only young and very, very fit people can donate.
A normal life cannot be lived after donating an organ.
Even if you take the organ, the body remains normal, and there is nothing like they would have a low quality of life or there would be danger to their life, apart from certain scientific known surgical complications which can happen early in the part, but the people will recover. But long run, they all will have normal life as like any other individual.
Well, that brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did, putting it together for you. You can find all of our reports up on our website. It's indiatoday.in. You can download the app. India Today social media platforms carry our reports as well. Our hashtag is Health 360, Health 360 Plus. You can find these on Instagram, Twitter, of course, X, YouTube and Facebook. That brings us to the end of this edition. Thank you so much for watching. Take very good care of yourself. Bye for now.